V Love Hub.
Welcome to another episode of V Love Hub. And on the show today, Judy and I will be speaking to Dr. Lily Gillespie. I hope I didn't butcher that. She's the founder of the Lily Clinic in New York City that specializes in treating postpartum patients with traditional Chinese treatments, such as acupuncture and herbal remedies. You're probably wondering, why are we talking about birthing and babies on a menopause podcast? But we're actually not. We're going to actually talk about pelvic organ prolapse, which is common in women 40s and over.
Hi, how are you?
Gillespie. I'll say for Anne.
Thank you for having me. Hi, how are you? Thank you for having me.
So can you just give us a little bit about your background?
Sure. I am a doctor of acupuncture and herbal medicine. My title is DAOM. It stands for Doctor of Acupuncture and Oriental Medicine. Me and my husband have a clinic here in New York City, and we currently live in Princeton, New Jersey.
Ah, I didn't realize that. So you have your own experience with prolapse. Can you tell us about that?
Well, first of all,
it
we
was
definitely. Sorry, Dr. Gillespie. Can we just know exactly what prolapse is? Because there are several different kinds of prolapses, right?
Exactly.
Okay,
Exactly.
so can we just get a little brief overview of what prolapse is?
Sure. In my
Okay.
clinical practice, I work with a lot of female patients. And in the more recent years, we started seeing more and more women need help with fertility support, such as going through IVF or IUI procedure. And I started studying a lot more about female issues. So what happened is in the pelvic floor organs, we kind of understand like there's a uterus, there's a fallopian tube, there's your ovary, and of course the bladder. So those are the organs that sit low in the pelvic floor. And different types of prolapse happen to women. Typically happen to older women or women with multiple deliveries. And sometimes they can be a bladder prolapse. Sometimes they can be a uterus prolapse. So what happened to me was 9 years ago when I delivered my first baby at home, I ended up having uterine prolapse.
Yeah, and did you
Yeah.
even know what prolapse was?
I did not know what happened to me, to be honest. So my baby was really big. She was 9 pounds. And so after she arrived, I was shocked about how this huge baby came out of me because I'm not very big. And about 3 days later, I went to the bathroom and all of a sudden I saw this protrusion. It looks like a ball. It wasn't like a stringy or a tissue. And I understand after you deliver your baby, the lining will continue to exit, to come out. So I didn't know what it was because it didn't look like tissue. And it was pinkish color and it wasn't brown or dark like the period. So at first I was very surprised and shocked. I wasn't scared yet because I didn't know what it was. And then my husband quickly looked up and did a lot of research. So it turned out that I had third-degree uterine prolapse. So there are 4 different degrees. The first degree is lighter, that you feel something is a little off. And the second degree is that when you sit down or it come to the contact of a surface, you feel something is outside. But in the third degree, you can really see it. And the fourth degree, of course, is the worst. The uterus is completely outside the body. So so I was able to see my internal organ. It was a very strange feeling. Surprisingly, I didn't have any pain. It wasn't painful at all. it was just very strange that I could see my internal organ. And of course, after I realized what it was, I started getting really scared.
Yeah. Yeah. I think I would have freaked out.
I know. So what happened next? What did you do then?
So I actually took a picture and sent it to my midwife and doula. I had a team of women to come to my house for my home delivery, and they were very professional. They consulted with me right away, and they saw the picture. They knew what it was. So at the time, I called my OBGYN. She presented 2 options for me. She
Which
said
were?
that surgical options. She said that right now, because that was 9 years ago, she said that right now the best we have is you have a couple options. One is insert a metal umbrella into my uterus and to keep it open.
Wow.
But if I would be pregnant again, the metal umbrella had to be collapsed to come out. And the second option was to stable my uterus onto the abdominal wall. And again, if I were to be pregnant again, my uterus will fall again. So it just sounded very, very scary with the options that I was presented.
So what did you decide? What did you decide to do with those 2 options?
None of them.
None of them.
None of them. Being a healthcare practitioner, when I heard those options, I didn't take it. I thought, really? This is the best you can do? This is the only thing that you can offer me? And of course, at that time, I just had a baby, and luckily, my mother insisted that I had help. And I didn't know. I thought, I'm really good with baby. I didn't need help. And I told her many times, no, I got it. Just a baby. But my mother insisted that my aunt, her sister, to fly in from Taiwan to help me with postpartum care. So she happened to be a professional postpartum care specialist. It's called confinement lady. So she was there with me. It's her job to take care of postpartum women. This is her field. So when she heard about my uterine prolapse and I showed her the picture, she just frowned and then shook her head. She called her sister, and immediately there were 3 binders mailed in from California and from Taiwan. They were going to help me, and I didn't know what it was.
Right.
So explain what's the binder?
Yeah. So what happened was that my aunt told me, basically, right now, you need to fight the gravity. After 40 weeks of expansion in your abdominal and from the baby, all your organs are out of the placement. They are not in their original spot. So my aunt told me that I'm going to bind you. And after the traditional binders are put on, you are going to put on the resculpting suit. And then she also has another piece of a binding material. It's elastic. So she has a set of 3. She told me that you need to fight the gravity. The gravity is taken over, and then all your internal organs are loose. So basically, they're coming down and out, coming out. So after she bound me, she also suggests that I sleep with 3 pillows underneath my pelvis with my legs against the wall. So I was really fighting the gravity for the following couple weeks. I was sleeping with pillows underneath my pelvis and sleeping with my legs against the wall.
Okay, and sorry, I just want to make something clear, which is I don't know what binding is, and I'm sure a lot of non-Eastern medicine practitioners would know what it is either. So what exactly, what is being bound? What is the material that is being used? And, can you just explain a little bit for us?
Yeah, sure.
Yeah.
On the market now, they are materials made out with elastic. So it's Velcro. It's something that you can wrap around your belly. Most people know of a pregnancy belt. So that's a belt that you wrap around your lower abdomen to support the weight of the baby. So the binding materials, some of them are similar to that. So it's made out of with a Velcro with elastics to help support your lower abdomen. So my aunt had a special material that's really long, almost 6 yards of fabric. And then she wrapped around my lower pelvis. I had to be down on the floor with my knees up. So imagine I'm doing a yoga pose. I'm laying down on the floor and then my knees are bent. I bend my knees. And then I use my hand to support my pelvis and lift up my pelvis. So at the time my head is on the floor, my feet are planted on the floor, and my pelvis is up against, elevated. Wow. And she started to bind me, from the ASIS. That's called that's the anterior superior iliac spine. So she started there and then wrap around my entire lower abdomen area, all the way coming up to the ribs. So once she finished that, make sure she will make sure it's really tight. And I will stand up, and then she will put on the re-sculpting suit. So the re-sculpting suit is a very stretchy material to help your body, and it helps support the spine as well.
So the suit, is it like a full suit, where like a cat suit, or
the suit is only from your pelvis and up. So it's a top for the top.
Okay, so it's just the top.
Yeah, just the top.
And how long do you have to bind yourself for? And do you have to change the binding every day?
So the ideal situation is that after you are bounded, you're not walking around, moving around, doing laundries or doing dishes. You're supposed to lay down and relax. You can do your pelvic floor organ exercise on the bed, but ideally you're not walking around, because if you bend down and walk around a lot, the binders will get loose. You do need to keep the binders on up to 8 hours a day in order to really see the result. And remember, after I had my baby, my abdomen was still very big. I was very swollen. I still looked like I was pregnant. So I was very swollen, and my feet were swollen. My abdomen was really big. I still looked like I was pregnant. So at the time, she just reminded me that your body just gone through this huge transformation. First of all your internal organs are not in their original space. And then now we're actually trying to uplift the organs. So I kept the binders on 8 hours per day, and I kept it on for almost 2 weeks. Yeah, almost 2 weeks.
And then the results?
It was magnificent. It blew me away. It really blew me away. Not only my uterus went back to its original space, original position, and also I shrank down a lot. I didn't look like I was pregnant anymore.
Right.
So yeah. And later I started to investigate and then learn more about postpartum care and realized that we have a hormone relaxant. Only the pregnant woman will have it. So the relaxant is a hormone allow your joints to be more pliable, allow the baby to exit. It will help with the birthing, delivering process. So the relaxant is made inside your body around the third trimester. You will start getting more and more relaxant. And the relaxant will slowly leave your body, and it will stay in your body up to 8 weeks after you deliver your baby. So within that 8 weeks, women can resculpt their body, their shape, and then it can allow their hip joints to be narrow again to prevent any internal organ prolapse.
Wow.
And what about, so how does it play into women over 50 and in their 60s? How does prolapse happen to women at that stage?
I actually have a patient right now is suffering from prolapse. She didn't know what it was. When I asked her, do you know what organ is it? And she said she doesn't know. And I realized this happened to a lot of women because not everybody study human anatomy. And she's not even sure what kind of organ it is. It's coming out of her body. And she told me it doesn't hurt. She said, it doesn't hurt, just very annoying. When I sit down, I feel this thing between my legs. So we ended up having bladder prolapse. It does happen to women. She has to be very, very careful. So what happened to her was she is older and her partner is 200-pound man. The partner fell in the bathroom and he was unconscious. She got really scared and tried to pick him up. But she's this little petite 5'2" woman, weighed probably 100 pounds. It was no way for her to lift up such a heavy, heavy man. So she strained herself and then causing the abdominal muscle to squeeze. And unfortunately, her internal organs weren't strong enough. So she ended up having bladder prolapse. When she went to visit her doctor, the doctor just put on the gloves and push it back in.
Push it back in?
Yeah. Manually push her internal organ back into her body. And
that doesn't even sound safe.
It doesn't, but that's how they do it.
Oh, wow.
Yeah. And then also her doctor suggests that if it happened to her again, she can do that manually, push her bladder back into her body.
Yeah, wow. I wouldn't even know.
I know.
I probably just like freak out and call the doctor and like run to the emergency or something. I mean, so once the doctor just pushes it back in, does it stay in or?
It really depends. She needs to strengthen in her core, her abdominal muscles. Yeah. Right. If your internal, there are 3 layers of abdominal muscles. One goes vertically and one goes horizontally and one goes diagonally. So there are 3 layers of our abdominal muscles. If her core strength, its center strength is very strong, it should hold everything in place. So for my patient, she needs to stop picking up something really heavy. And also she needs to stop squatting down to the floor.
Right. And core exercises.
Right.
So, so like what type of pelvic exercises can you do to prevent? Because I guess it can happen anytime because, it could be just from one incident of lifting something really heavy and you can have a prolapse. Right. And it's just because our organs are just not, strong enough or our pelvic floor is too weak.
Right. So earlier I mentioned that prolapse could typically happen to older ladies or women with multiple deliveries. So if your core strength is really strong, your internal organs should stay inside. Doesn't matter how old you are. But eventually, as humans get older, we are going to get weaker, and the gravity do take over in terms of sometimes like our face stripped down, our breasts is stripped down. So the gravity do have an effect.
Right.
Yeah.
And do you do binding for, let's say, postmenopausal women or menopausal women as well?
Yes. It will work as well. For the postpartum woman, they don't. For the postpartum woman, they have a relaxant. But for the if you have if you just deliver a baby, you have the relaxant, so it really helps. But for the women that who don't have a relaxant, such as perimenopause or menopause women that we're not pregnant, we don't have a relaxant, the binders still work. But you do have to keep them on more often.
And since there are no real signs, like there's no pain involved, are there any signs that something might be going on before the organs are actually popping out? Could there be any like warning signs that something might be wrong? Or I might be getting a prolapse, about to have a prolapse?
No, unfortunately, most of the time, women would not notice. Even in the first degree uterine prolapse, the prolapse is dripping down a little bit, but it's still within our body cavity. So we don't have a lot of sensation that you don't really feel it. So in my patient's case, she had a bladder prolapse, and it was severe enough that she can see it in her eyes. So there, unfortunately, there's no warning signs.
Yeah. So basically, you don't know if you're in the first stage or the second stage. What you will know is when something is popping out.
When you finally see it. Yeah. Some people might feel it at a stage 2.
And
like this pressure.
And is it common that you get absolutely no pain?
It's very common. You don't really have pain at all. Yeah. But you need to be very careful, because when an internal organ is outside the body like that, you're prone to infection, bacteria infection, yeast infection.
Yeah.
So that's very dangerous.
Yes.
Right. And bacteria and yeast are coexisting harmoniously together. So we just want to make sure we're very careful with that, because what happened to one of my patients who had a prolapse, she ended up having yeast infection. And then she was taking a lot of medication to kill the yeast, and then she ended up having a bacteria infection.
Wow.
And then she started taking medicine to kill the bacteria, and the yeast rise again. So she ended up suffering a whole year of infection between yeast infection and bacteria infection, and for the whole year.
Yeah.
Wow.
Yeah.
How common is prolapse in women over? Sorry, we keep stepping on each other. I think there's a delay or something. But how common is a prolapse in women over 50, say?
I would say it's common enough that you will know one of your friends have it, but nobody wants to talk about it.
Right.
Really?
It's very true that even if it happened to them, they don't want you to know.
Yeah, it's very embarrassing.
Embarrassed about it. Yeah.
Yeah.
And even like with women that I work with, 80% of women that I knew, after they deliver their baby, they had some sort of incontinence. When they cough or sneeze, they have accident, they pee themselves. And again, nobody wants to tell you about that.
Yeah.
And that's why I love you guys, because you guys are encouraging women to talk about it. And then that's why you're doing such amazing, important jobs, because this is nothing to be embarrassed about.
Right.
Yeah, no, and I wouldn't even know how to. I wouldn't know how to push my bladder back up there.
Yeah.
So I
know. So, okay. So basically, if let's say I go to the bathroom and I notice something is bulging out between, my legs, first thing I should do is push it back.
Of course, like you said, you want to call your doctor right away.
Okay.
And
so do I try? Sorry. So the step is do I try to push it back first, or call my doctor first and say, should I push it back now, or should I come in? No, because I just want to be clear, because as you said, women don't talk about it. And if it happens to them, what are the first 2 steps I should do?
I think the first step, you should definitely call it your doctor.
Okay.
And if the doctor received telemedicine, that you can take a picture and send it to your doctor. Most women will not have any idea it's either uterine prolapse or bladder prolapse, because they can't tell. Most of us have no idea what internal organ looks like, right? Because we've never really seen them before. Let's say that if the prolapse is very severe and you have a long way to travel from your home to the doctor, I would say wash your hands, cut your nails very short, wash your hands very, very cleanly, thoroughly with soap, and then push back in. So if you go to the clinic, that's what they do as well. They need to push your internal organ back into your body first.
And can somebody call you?
Yeah.
Like if this happens to me, would you be a person I could call or not?
This is not my scope of practice, and I'm sharing my experience as a woman, as a Eastern Asian medicine practitioner. This is unfortunately not my scope of practice, so I will refer you to your primary care doctor or your OBGYN, right?
Okay.
So they need to know your condition. They need to give you a proper diagnosis as well. Right. Yeah. But I can tell you from personal experience, it was scary, but I also want people to know that love your body. It is your body. Don't be afraid.
For sure. But so just to be clear, you provide acupuncture and traditional Chinese herbal remedies as part of your practice?
Right.
Okay.
I also do massage. I do Tui Na. It's a Chinese medical massage, and I do the channel palpation for my patients.
What is that?
I basically massage the body followed by the channels, by the meridians.
Oh, yeah.
So there are 12 primary meridians and 8 extraordinary channels.
And do you do binding as well?
I do.
Okay.
I have a lot of female patients. I do fertility support, and I will guide them through, especially after they deliver their baby. So more and more people know as a 4th trimester or the first 40 days. So it's the first 40 days after baby.
For an older woman, let's say for me in my 50s, and let's say I have some form of prolapse. And, I go to the doctor and the doctor said, well, here's your option, the surgery, the umbrella. Would it be safe for me at being menopausal to do the binding? Okay.
Binding
so that would be an option.
That would be an option, yes. Binding is safe in terms of you don't need to take any painkiller. You don't have to take any medication with that. But you certainly want to make sure that you contact someone and talk to someone who know what they're doing. Because there's a chance that if you purchase binder online and if you put it in the wrong place, it could push the bladder down even further.
Oh, okay.
Yeah.
Right.
It happened to people before where the woman had the uterine prolapse. Oh, no, sorry. So the woman had a bladder prolapse and she contacted her physical therapist. So it was the physical therapist told her to purchase a binder and just put it on. But then
and she did it herself.
She just did it herself. She just put it on herself. And it ended up pushing her bladder down even more.
Okay. So you really should have someone else do it for you.
Right. You have to understand your anatomy. You have to know where your bladder is. You have to understand once you put the binder on, it's supposed to squeeze and uplift instead of squeeze and push down. So it's very important that you know your anatomy.
Okay.
Wow. Well, thank you.
I think that's all we have time for today, but this has been such an education. Yeah. I mean, this is something I didn't know about. I know it does go by really fast. But I really thank you for giving us this information. It's very, very useful information. As you said, we don't like to talk about things because we're so ashamed of things that are happening with our own bodies. It's kind of crazy, but this will hopefully encourage people to speak up and get help.
Right. There's nothing to be embarrassed about.
Yeah. Yeah.
Thank you for coming on the show and sharing your experiences with us.
Thank you so much.
Very helpful for everyone.
Thank you.
Thank you so much. And are you on Instagram, or should people check you out on Instagram?
People will
or
be
your
able
website?
to find me at my website.
Information?
And it's called lili.care. LILI.care. even in my website that you can find binding instructional video. I teach people how to do it, and I teach people like really pay attention to their pelvic floor organ health. Like at least know the anatomy. You need to know where your bladder is, where your uterus is. So if you need to do the binding at home, you know how to do it.
Great.
Oh, that's great.
Okay. Thank you so much again.
V-Love Hub is produced by Judy DeMello and Ann Katari.
We've got lots of great resources listed on our website, vlovehub.com. That's VLUVHUB.com.
Follow us on Instagram, Facebook, and LinkedIn. Please rate and review us on Apple Podcasts or wherever you download your pods.